Hello, study buddies. Welcome back to GrowMed. Welcome to the series Super 30. And today is the day 11th. So we'll be discussing the important topic for the upcoming exam, that is the male urethra, rupture of the male urethra, and what all manifestations can be seen. Because according to my analysis, this question was asked multiple times in the past years, and uh, sometimes related with the anatomy, sometimes with the surgery, sometimes what questions were asked on the like a clinical case based question. So it is a very important topic, and in the recent exam also the question was asked on this one, rupture of the urethra. So I felt why not discuss it and include it in this Super 30 series. Okay, so first we'll discuss about the male urethra. See, the male urethra is classified into the four parts actually: the prosthetic urethra, membranous urethra, bulbar urethra, and the penile urethra. So see here, it is usually classified into the anterior part and the posterior part, the male urethra. So the bulbar urethra and the penile urethra, whichever comes now, these two are classified into the anterior part of the urethra, and these two are classified into the posterior part of the urethra. So these are the parts of the male urethra. I think I have the image. Yes, the image also. The parts of the anterior urethra, which comes here, you can see here the bulbar and the penile urethra, and then the posterior part, the prosthetic and the membranous urethra. Okay, so let's look at the injuries. So if there is bulbar urethra rupture, bulbar, which part? See here, it is the anterior part. So the blood will be collecting mostly in the anterior region, this region, and the blood can be seen at the tip of the meatus. So this one will be can be described in the clinical case: blood present at the tip of the meatus. See, and you need to remember about the urine also. Urine retention, the extravasation of the urine will be happening in which all region it will be happening? It will be happening in the superior perineal pouch, scrotum, penile region, and the anterior abdominal wall. As you can see here, see, the urine extravasation will be happening at this area, the anterior abdominal wall. It will be going, that will be going to the superficial pouch, and it can also go into the scrotum. From here it can go into the scrotum will be present here, right? So yes, these are the locations where there can be extravasation of the urine. Then you can see a butterfly shaped perianal hematoma also in this kind of rupture, and these kind of injuries are mostly associated with the straddle type injuries from falls or kicks, like pat hole. If a person falls in the pat hole, then pat hole fall, then he can get injury to the bulbar urethra, and that will be classified as the anterior urethra rupture. Okay, so these only things will be described in the clinical case. Like if you need to look at the history also, like which kind of fall it is, or which kind of injury the patient is having. Then membranous urethra rupture. So membranous urethra is a part of the posterior urethra. So as you can see, a posterior urethra. So whenever this rupture to this membranous urethra, the urine extravasations will be happening in these places. So the collection of the urine, in simple words, so the urine will be collected in the deep perineal pouch around the prostate and the bladder and the posterior abdominal wall. It is quite simple to remember. It no need to like go much detail into it. So we know that already it is classified into the anterior part and the posterior part. So this is the prosthetic membrane, then this is the bulbar, this is the penile urethra. So whenever this rupture to the bulbar urethra, all the anterior things will be involved, and if there is a post injury to the membranous, or the posterior things will be involved. Just remember this basic concept, and you can apply it in the options, rule out the options, and easily reach to the diagnosis. Okay, so in this, pelvic hematoma can be seen. Okay, then most common cause is the RTA with the pelvic fracture. See here, the cause is also different for both. One is the falls or the kicks due to the injuries, and one is for the RTA. So this is also one important differentiating factor between both of the things, which can be described in the case. So yes, this is about the diagram of the male urethra. So thank you so much for watching this video, guys. For the PDF, join the Telegram channel and comment below how do you find this series, like is it useful to you, and if you want me to continue the series in the May also, then we can continue it. Yes, so all the best for the exam. I am Dr. Padmini, your mentor for the FMGE. Like the video, comment, share it with your friends, and if you're new to GrowMed, subscribe to GrowMed. Once again, thank you so much and all the best for the exam.